So we just reviewed the abdominal causes of chest pain, and so aside from the abdomen, well, first we talked about the chest itself, so the heart, the lungs, then we went down into the abdomen to talk about that. And now, aside from that, when we're looking at the context of the area of the chest, the insides of the chest can cause pain, but also the outsides can cause pain. And so when we talk about that, we're talking specifically of the bones, the muscles, and the cartilage. Now, there are muscles that attach to the chest wall itself, and so those are kind of like your pectoral muscles. There's also some muscles down here called your serratus anterior, and so there's actually a bunch of different muscles, but which I don't expect you to know for what we're talking about here. But when we talk about musculoskeletal causes, there are a ton of different causes, but the one I really want you guys to focus on is costochondritis, and we've talked about that a bit during our live sessions and in some of the materials that I sent out before. So let's start with costochondritis. So in costochondritis, you have inflammation of the cartilage that connects the ribs to the sternum. So this kind of blue-ish area right here is that cartilage that connects the ribs to the sternum. And so with costochondritis, you typically will have pain adjacent to the sternum, so right next to it. So what are some of the things that cause costochondritis? Well, things that will make that area sore generally. So a lot of times we see it with people that are coughing a lot. So as you cough, you are working these muscles harder. You're causing more contraction inwards, and to really force whatever it is that you're trying to cough out from the thoracic cavity. So that over a long period of time, especially if you're sick with a cold and you just have this persistent cough, is going to cause these joints to move a lot and a lot more than they're used to, and so you're going to cause inflammation in this area here. So the pain, like I said, is peristernal, so right next to the next to the sternum. The most important thing is it's usually reproducible. So as you push onto these areas on your physical exam, it's going to be painful and it's going to reproduce the pain that the patient has. Usually they'll tell you that it's sharp or achy, and the pain is usually going to worsen with deep breaths or a cough. And so, like I said, it's commonly associated with a cough or recent viral illness that is getting better, but now they have this kind of chest tenderness. And if any of you have been really sick before and had a chronic cough, you remember the tenderness you had in your chest. The vitals are normal. If you have somebody that's anxious, they can have a little bit of an elevated heart rate, but they should look completely normal to you. The physical exam is normal except for that reproducible chest pain, and then you really shouldn't be getting labs unless you think that there is something else that could potentially be going on. You don't ever want to say that it's just costochondritis when it might also be a heart attack. So keep your suspicion a little bit high still, and really rule out that possibility of a heart attack. But if you are convinced that this is 100% costochondritis, you don't need to do any labs. And the treatment for costochondritis is going to be non-inflammatory medications, or non-steroidal anti-inflammatory medications. So ibuprofen, Aleve, and Advil, all of those things. And then Mobic is the other one that we typically use. So any of those medications that decrease inflammation is going to be good for costochondritis. Ice and heat helps, and then stretching the muscles in this area. So you also have some muscles that attach to the chest wall, and doing stretches will kind of help open up these areas too. And lastly, we have anxiety. Now, anxiety for a lot of doctors can be pretty frustrating because it is a very difficult thing to treat. And if it's frustrating for us, it's going to definitely be frustrating for the patient too. And so it's important to be able to pick out anxiety whenever we can, but it's also very important not to say that somebody's pain is just anxiety and kind of revert to that. So for me, anxiety is always the last option. If there's nothing else that can explain this patient's pain and it looks like anxiety, then we can say it's anxiety. So that's why I say here, it's generally a diagnosis of exclusion. So the chest pain is usually associated with panic attacks. typical anxiety wouldn't usually give you chest pain. It's when it progresses to that panic attack where it feels like you're about to die, like something bad is going to happen. That's typically when you get the chest pain. A lot of times you'll have a trigger, something that increases your stress. So a test can do that. It can be something like you're in on the freeway and that causes a panic attack because you were in a car accident 2 weeks ago, something like that. So anything that increases stress, separations can cause panic attacks. A recent death in the family. Oops, I keep doing that. Recent death in the family, drugs and medications can also induce panic attacks. And so the key thing with panic attacks is that a lot of times they are abrupt. You kind of have that anxiety in the background, and then it abruptly you start to have this chest pain, and you have the shortness of breath. You have the other signs of panic attack, and it's definitely not 100%. It's not for everybody that it's going to be abrupt like that, but because you can have anxiety levels that are just creeping up, and you eventually get to the level where it's like, wow, this is a full-on panic attack. So it's variable, just like everybody's anxiety is going to be variable. So what are the signs and symptoms? It can be a lot of different things. So a lot of times what we're talking about here is chest pain and shortness of breath. Those are pretty common. A lot of times you'll have palpitations as well. Some sweating, especially the palms, the armpits, and that can also induce some more anxiety. Sometimes you can have some shaking, looks like tremulousness. You can have a choking sensation in the back of your throat, especially if you have a speaking event that's causing you to be anxious and start to panic. Some people get nausea. Some people get dizzy. With panic attacks specifically, a lot of times you'll have this fear of dying. You have this fear that something bad is going to happen and you're going to die. The exam is generally normal. You can have some tachypnea and tachycardia. The tachycardia I see a little bit more often. Well, actually, no, they're both pretty common. So you're breathing fast and your heart rate's going fast. And so the treatment is going to be the treatment for anxiety. Panic attacks are a little bit different, but anxiety, we really want to move away from quick fixes, because anxiety in general is a long-term thing, and a lot of the quick fix anxiety medications are very addictive. So for anxiety, the first line is typically an SSRI. It's an antidepressant that works for anxiety as well. The quick fix that I was talking about for anxiety and panic attacks are your benzodiazepines. So medications like Ativan, Xanax, all of those are going to make you feel a lot better, a lot more quickly, but over time they can be very addictive. And so we try to avoid that as much as possible. So I hope all of that made sense and it was clear to you. All the different types of all the different causes of chest pain. There, like I said before, there's a lot more things that can cause chest pain. This is kind of just the surface, but I think for our purposes here, it's good enough to be able to develop a pretty robust differential diagnosis. Now, I'm going to be putting out more videos on some more specific topics within chest pain, and to help you out for our cases next week. But what I want you to do, what I want you to focus on is look at the differences between each of these diseases and each of these conditions, and see and try to really pinpoint on those differences, because noticing those patterns and knowing how one thing is different from the other is how you are able to differentiate between the different causes of chest pain and narrow down your differential into what you actually think is going on with the patient. We'll talk a little bit more about some of the theory behind medical decision making, specifically illness scripts, and I'm actually really excited about that lecture because I think that is something that a lot of medical students and residents even aren't really taught. I did not learn that in medical school, and I didn't hear about it until I started residency. So we'll go over that in the future. But after chest pain, after our cases this coming weekend, we're going to be starting to talk about abdominal pain, which is its own separate beast, but it's one of the more fascinating topics that, in my opinion. So if you want to continue helping us and supporting us, like the video, share it if you think it's going to be helpful to somebody, and subscribe to the channel. If you have any ideas of different things you want to learn about aside from this, also let me know, because I want to also talk about things that interest you. And so as much as I can contribute to your education, I would love to do that. I'm excited to work with you guys this weekend, and I will talk to you soon.